Zika virus by Dawn Jenkins, NU661-02-19, primary care childbearing women. The Zika virus is a flavivirus spread through the Aedes aegypti mosquito. Zika is a stranded RNA virus that was discovered in 1927 in the rhesus monkey. The virus is not considered dangerous to anyone apart from pregnant women. Zika virus may be transmitted to humans via the following route: bite of an infected mosquito, maternal fetal transmission, breast milk, sex, vaginal, anal, and oral, blood product transfusion, bodily fluids, organ transplantations, and laboratory exposure. Epidemiology and incidence. The first isolated case was in Uganda in the Zika forest in 1947, with the first evidence of human infections in 1952. In 1954, 0.5% were positive for Zika antibodies. In Nigeria, between the years of 1971 and 1975, 38% had neutralizing Zika antibodies. An outbreak in Yap Island between the years of 1983 and 2006, 1 in 5 were infected. In Senegal, Africa, between the year of 2008 and 2013, 3 cases were identified and 1 in Colorado. In Brazil, in 2013, an epidemic of microcephaly in infants were discovered. In Brazil, in 2015, Zika was identified, with 163 cases reported each year. In the United States, a total of 4,175 Zika cases were identified as of November 9, 2016. Massachusetts, 98 travel-associated cases of Zika. In Florida, 708 travel-acquired cases of Zika. In United States territory, 31,093 locally acquired cases, 195 travel cases, and 46 Guillain-Barré syndromes as of November 9, 2016. There have been 26 live births with defects. Clinical manifestations of the Zika virus. The subjective signs. In general, most people infected with the Zika virus have no signs and symptoms, while others have mild fever, rash, and muscle pain. Other signs and symptoms may include headache, red eye, conjunctivitis, retroorbital pain, abdominal pain, nausea, vomiting, diarrhea, pruritus, mucous membrane ulcerations, and a general feeling of discomfort, which can last anywhere from 2 to 7 days. Objective signs will be an RRT-PCR test on amniotic fluid, serum, or urine, a Zika immunoglobulin M, which will be positive, non-purulent conjunctivitis, maculopapular rashes, and a fever between 100 and 103 degrees Fahrenheit. Maternal, perinatal, and fetal risks and follow-up. Maternal risks include self-limiting and mild symptoms and Guillain-Barré syndrome. Perinatal and fetal risks include microcephaly, congenital Zika syndrome, birth defects, brain abnormalities, eye defects, hearing defects, limb abnormalities, placental calcifications, miscarriage, stillbirth, growth restriction, poor sucking, feeding difficulties, and an unknown prognosis of the infant. Follow-up consists of frequent ultrasounds in pregnancy, MFM consult, possible therapeutic abortion. Referrals for neonate would include a neurologist, endocrinologist, infectious disease, geneticist, lactation consultation, speech therapy, occupational therapy, nutritionalist, and gastroenterologist. Labs and testing for the neonate would include a CBC, a CMP, hearing test, brainstem response screening before 1 month of age, and repeated in 4 to 6 months if normal. Diagnostic, treatment, and education. Zika can be detected via urine and blood. It is also recommended by ACOG to complete an RRT/PCR, a Zika immunoglobulin M, and a PRNT. Positive and inconclusive reports must be reported to the Department of Public Health. Zika assessment should occur with each prenatal visit. Treatment for this virus is supportive, acetaminophen for pain and fever, fluid resuscitation to prevent dehydration, and serial fetal ultrasounds every 3 to 4 weeks. Education is stemmed around preventing transmission through safe sex practice, use of mosquito repellent, wearing long sleeve shirts and pants, and removing stagnant water. Also, avoiding traveling to areas with Zika outbreaks and mosquito-proofing live-in quarters. Differential diagnoses include the dengue fever. This virus and the Zika virus has similar clinical manifestations, which are fever, muscle pain, and headache, and are transmitted by the same mosquito vector. Parvovirus virus. This infection can present with similar clinical manifestations as Zika, such as arthritis, arthralgia, and rash. Rubella presents with clinical manifestations such as low-grade fever, coryza, and macular rash. Chikungunya presents with similar clinical manifestations such as fever and joint pain as Zika and transmitted by the same mosquito vector. Measles present with similar clinical manifestations of fever, cough, sore throat, coryza, conjunctivitis, lymphadenitis, and rash. Malaria presents with similar clinical manifestations such as fever, malaise, nausea, vomiting, abdominal pain, and arthralgia. Rickettsial infections present with fever, headache, and myalgia, and it is transmitted via the African tick bite. Referrals for the neonate would include neurologists, infectious disease, ophthalmologists, endocrinologists, and clinical genetics.